voila, and here we are. Okay, so let's go ahead and get right into it because we have some stuff to talk about today. Okay, let's open these blinds and let's get this dog out of solitary confinement. And y'all, if y'all see glimpses of my apartment, just don't even say anything because it needs to be cleaned up, and I'm just sorry. I might do it today. Maybe, we'll see. Alpha! Hi, baby. Hi, baby. Good morning. Good morning. Good morning. Good morning. Good morning, my love. Oh, you got your bone? You ready, huh? You ready, huh? Let's go outside. So first things first, one, I'm ready to take these dreads out of my head, or locks out of my head, because one day is so old, y'all. My hair has grown out, honey. We need to get these locks out too. Thing two, I am almost done with this court. Ow, Alpha. You want to play? You want to play? Goodness gracious. Okay, we're rolling over. All right. We're almost done with this quarter, y'all. We're almost done. Literally, the quarter started in June, the beginning of June, or the end of May. No, the end of May. May 24th or May 25th. That's when the quarter started. The quarter, I'm in my last module. This week is the last module, and then next week is the final exam. I'm so ready. I'm ready to be done. I'm ready to be done with all these finance classes. I'm ready to be done with all this math. It's just ghetto. I mean, we've done it. We're getting through it, but it's ghetto. I don't want to do it anymore. I'm ready to move on to medical sociology, which is what I have next, and then I believe I have like, I'm not even gonna try to lie to y'all because I don't even know what the other class is. But I know for sure that I got medical sociology, and that's gonna have public health. My public health senses are tingling. I know it's gonna have public health tied into it somehow because we got sociology. I know it is. So I'm so excited about that class. Like, I already know I'm gonna be all into it. I'm ready. So your girl's almost done with her first set of classes. Come on, Alpha, let's go outside. Your girl's almost done with her first set of classes. Let's open these blinds. Should we open up ourselves to the world? He's worried about his pig ear. He don't care about what I'm saying. Okay, we're gonna open ourselves up to the world now, okay?
Y'all, he's been peeing on this carpet right here. Come here. Come here. He better not pee on that carpet. He been going outside and peeing on that carpet and not telling me. Ain't that right? Shaking my head.
All right, you guys. I'd probably say there's 3 big reasons why I chose MHA, a Master's of Science in Healthcare Administration, over a Master's in Public Health. The first reason is versatility in the job market. So if you're new to my channel, welcome. Happy to have you. But if you are new, you probably don't know that I already have my bachelor's degree in public health. So getting another degree in public health just didn't seem right to me because I already have some knowledge on public health. In order to make myself a more versatile applicant, I wanted to add another skill set to my pools. So of course, have my bachelor's degree in public health. I love public health. I love public health. If you don't really know what public health is, I'll just say in a nutshell, public health is community and population health. So whereas doctors, physicians, nurses, whereas they treat individuals, public health practitioners treat communities. So to give you kind of like an example, if we make up a random lake no name, let's call it Lake No Name. If 30 to 40 people come to the hospital with vomiting and diarrhea, and it turns out that all 30 and 40 people have norovirus, let's just say they have norovirus from swimming in the lake No Name, okay? This is all fake, but I'm making this up, but I'm trying to give you an example, okay? So that is a trend. if all these people went and they swam in this lake and they all ended up getting the same infection, then that needs to be investigated. And the people that would investigate that are public health practitioners. That's kind of what we mean when we say community health, treating the community versus treating the individual. When a doctor treats you specifically and prescribes you medication, he's treating the individual. When public health practitioners help develop laws that you need to be vaccinated against the flu, investigate construction sites that need to be shut down because a bunch of workers are getting respiratory issues from working at the construction site, that is public health, that is community health. So that is kind of like, in a nutshell, small examples of what public health kind of encompasses. Also, I wanted to have a direct impact on patient experiences. So what do I mean by that? There are a lot of things that happen in the healthcare workplace that, although some providers, as in physicians, PAs, nurses, may not necessarily agree with and may not like, they can't necessarily do anything about it because it all comes down to policy. And the people making the policy are the people on the business side of healthcare. The healthcare administration, the healthcare business, those are the people making the big decisions for the hospital or for the clinic or whatever the case may be. And those decisions are directly impacting the way that providers give care, therefore directly impacting patient experiences. As a healthcare administrator, you have to make sure that your clinic or your hospital is running smoothly. You have to make sure that your providers have what they need in order to give the quality of care that is desired. On top of other things like making sure that the workspace is inclusive, making sure that everybody feels respected in the workspace, making sure that everyone is doing their jobs, making sure everyone is doing their jobs correctly. There are some jobs in healthcare administration where you do have to kind of be the stickler and, kind of give people warnings, let people go, whatever the case may be. Because at the end of the day, not only is your job to make sure that the hospital continues to run smoothly, but it also is your job to make sure that the hospital continues to be a safe space for everybody, the employees, the patients, everyone. So if somebody is making the space unsafe or uninclusive, then depending on what your position in healthcare administration is, it may be your job to kind of put the hammer down. So I wanted to go in and prioritize patient experiences. I know a lot of people say that healthcare managers and healthcare administrators are too focused on money, too caught up in the money aspects of it, and they're not focused enough on the patient and what the patient needs. I know there's some pull and tug there. I know there are probably really hard decisions that healthcare administrators have to make, and probably some really hard decisions they have to make that healthcare professionals don't like. But I'm definitely going to do my best to make sure that the patient is getting the quality experience that they deserve, while also making sure that our hospital is staying afloat. So my number 3 and my last one that I'm going to give you guys today is the job and money outlook. So just based off of the research that I have done for my area or areas that I may potentially be in later on. Of course, jobs in public health have been rising because of COVID and because of all of these other diseases that are coming out of nowhere. If you guys didn't know, overall pandemics are the responsibility of public health. Pandemics, endemics, all those things are the responsibility of public health. So whenever a major health crisis like that pops off, most of the time the teams that are assembling are public health practitioners, epidemiologists, all of those jobs that essentially fall under the public health realm. Of course, there are other professionals that are also coming together to solve this issue as well, but I'm just letting you guys know that big pandemics like this typically are the responsibility of public health as a whole to, figure out where it's coming from, how do we stop it, what's the fastest way to stop it, all these things. So public health jobs have been on the rise because of COVID, but typically when there is not a crisis going on, job outlook is not always the best for people who hold masters in public health. I mean, obviously they can differ based on area and things like that, but from my experience and my research, that's what I have seen. Also, typically, if we're talking salary, healthcare administration jobs typically pay a bit more than public health jobs do. I will say public health does not get a big lump sum of funding. I believe I'm about to pull this out of my bachelor's degree brain, but I believe public health only gets 3% of national funding out of everything, just 3%. Yes, y'all, I was right. They get less than 3% of national funding, less than 3%. Despite the fact that the lifespan of persons in the United States have increased by almost 30 years, and 25 of those years have been attributable to public health. 25. And they only get less than 3% of national funding. So it's not their fault that they aren't able to pay as much as probably, healthcare administration, healthcare business jobs have been able to pay, because a lot of money is going into our healthcare systems, right? As healthcare in itself as a being continues to grow more complicated, more complex, the need for healthcare administrators and business professionals to run these healthcare businesses will grow as well. Healthcare beings get a lot more money, a lot more funding. We have a very expensive healthcare system, so by nature there's a lot more money there. So healthcare administrators and healthcare business professionals just get paid more money than public health professionals do. That's just kind of like how the numbers roll. So that was my third and final reason for choosing ultimately to get a master's in healthcare administration. I feel like this makes the most sense for me. For all of those reasons and other reasons as well. I feel like I said this in my last video, but this choice just makes sense for me and what I'm trying to do and the impact that I want to make. Being a healthcare professional would be amazing. Being able to directly impact, individual lives would be amazing. But a lot of the issues that we're seeing in our healthcare system are not because of individual people. A lot of the issues that we are seeing are because the system itself is messed up. So if we're gonna make an impact there and try and repair the system, then we need to be in positions where we will be able to repair the system. So those were my 3 reasons on why I chose MHA over MPH. I hope you guys enjoyed this video. Make sure you like this video if you liked it, and if you love this video, then go ahead and subscribe to my channel. I do want to say that if you did choose MPH over MHA, I think that's amazing. I think everybody has their own journey, and like I said in the beginning, I love public health, so hey. If you are struggling with this decision, or if you have made your decision and you just are here to watch the video, go ahead and make a comment down below. Let me know your story. Let me know what you chose. Let me know what you're thinking about choosing. Let me know if you're in college right now, you just trying to figure it out and trying to see. Let me know something in the comments down below. I love y'all. XOXO, and I am MHA.